Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood. Today I have a very special guest, Harriet Wilson, and she's with I.D.E.A.L Therapies, and we're going to talk about something really different today. So I'm super excited, and so because Harriet has a really cool business, so Harriet, tell our listeners what exactly is recreational therapy, because just the name sounds fun.
Oh, yes. So, recreational therapy, we utilize recreation and other activity-based interventions to address the assessed needs of the individual. So it is a very rewarding job. We as recreation therapists, we like to say we play with the purpose. Um, we do lots of activities and interventions that focus mainly on the individual's physical health, emotional health, cognitive health, social health, and spiritual health. Those are our five domains. And we differ from physical therapy and occupational therapy in several ways. You know that a physical therapist assists injured or ill individuals to improve their movement and pain management. And then you have your occupational therapist to improve individuals with the tools they need to succeed in day-to-day activities. So we as recreation therapists kind of use our activities and interventions to do both. With the pain management, we can do exercises, things like yoga, tai chi, aquatic therapy, and like for assisted daily living or day-to-day activities, we can do certain interventions or activities such as fine motor skill activities and things like that.
So, what are the benefits for seniors of doing recreational therapy?
So there's a wide variety of benefits for seniors who engage in recreation therapy. Some of those benefits are recreation therapy reduces depression, anxiety, and stress. It improves motor functioning. It increases cognitive skills. Recreation therapy can also assist to establish routines. Recreation therapy increases tolerance and endurance for participation in life and social activities. One of the best activities I think recreation therapy does is it maintains strength, balance, and endurance. It also enhances coping skills and promotes active aging, wellness, and healthy living.
Okay, so we're not playing dodgeball, right? Because that was the first thing I'm thinking. Recreational, man, dodgeball sounds fun. As grown-ups, sometimes you like to get some people across the room from you and throw balls at them. A nice little safe, fun.
Well, depending on the population, because recreation therapists, can work with a wide variety of populations and ages. So we also work with kids and adults with developmental disabilities, cognitive disabilities, traumatic brain injury, PTSD, seniors, so on and so forth. So depending on that age group and the treatment plan for that individual, something like dodgeball may may end up being an activity for that individual. It just depends, definitely on the age and their ability. Yeah.
So this was really new to me, and that's why I'm super excited you're on the show today, because this was all like recreational therapy. That sounds like fun, and your brain can go in so many different places for recreational therapy. So what are the licensing requirements for somebody like you to do it? Are they different than occupational therapists and physical therapists, or they run primarily very similar?
Well, it's It's similar, but with recreation therapists, we do not go to school as long.
Oh, nice.
So we do have to attend a accredited college and obtain a bachelor's degree or higher, and also attend a 12 to 14 week hands-on clinical internship, and then we do have to pass a board certification exam. But that can only take 4 years, if you were to go for only your bachelor's. And then if you want, some of us do earn a master's in recreation therapy who want to continue our education. But it's not as long and as strenuous as becoming a physical therapist or occupational therapist.
All right, so now we're going to dig a little. So let's talk about the different types of, what kind of activities do you do? I mean, are we taking dance lessons? I know you said Tai Chi, yoga, always good, but I recently saw, I was in Paris and we were walking back to the hotel, and all of a sudden, all these people were dancing in the middle of this little courtyard area. And as the music kept going, more people just kind of started dancing with them. So it got to be a pretty big group of people dancing to the music. It was really entertaining. And so what kind of activities do y'all do?
Also, there's also a wide variety of activities, but focusing just on senior activity, like you mentioned, the dancing, the Tai Chi, those kind of activities are very beneficial, especially for older adults living in assisted living facilities or, things like that. So that's a form of physical exercise, actually. But, so recreation therapy, we want the individuals to have fun and not think of it as therapy, but it really is, So I always tell my clients or patients, you focus on having fun, I'll focus on the therapy aspect of it. So I don't want to bore you with the amount of activities or the different types of activities, but I'll give you some examples. Our activities, they're designed to stimulate creative self-expression and improve motor skills. So anything from arts and crafts to coloring can relieve anxiety while promoting a sense of self-confidence. And then we have, for individuals with maybe like dementia or who experience being lonely or agitated, we have doll play. Doll play has been found to be very beneficial. This form of therapy allows seniors to gain a sense of independence as they care for and nurture the baby or stuffed animal. Another is music activities, by taking part in activities such as drum circles, sing-alongs, and musical performances, seniors can experience a reduced stress, cognitive stimulation, and creative self-expression. And then also, let's talk about aromatherapy activities. So certain smells have the ability to promote a sense of calm. So smells such as lavender and peppermint are great for relaxation and calming. So it also is has been a powerful link to your memory as well.
I was thinking the smell of chocolate chip cookies.
Hey, and even like that, just baking cookies. We do this activity or this intervention called reminisce therapy. So just that you have an older adult, say they have Alzheimer's or dementia, and you're baking cookies, and it can bring them a memory back, from when they were a kid, with their parents or even with their grandkids before they, had the disorder, So hey, anything smells.
Yeah, because there's a lot of good stuff out there that brings, that triggers, I think different types of memories as well. And so,
yes, definitely.
So what about aquatic therapy? Is that part of something you do as well?
Yes, ma'am. Aquatic therapy is also an activity or actually just a different session or therapy that we do provide as well as recreation therapists. So it's a great way for seniors to maintain and achieve physical and rehabilitation goals. So aquatic therapy includes a wide variety or wide range of exercises that are done in the water. And these exercises include like water aerobics, strength training, yoga, water jogging, and swimming.
See, I like to float, so that wouldn't be very beneficial, right?
It could, if you had, say, one of the goals that we had for the seniors was to learn to relax more, you know. So floating, with the assistance of a recreation therapist, teaching them to float or just having them float for at least 5 minutes and play calming music. I'm a big fan of playing music during my activities because music is is very beneficial, especially when you're trying to relax and relieve stress.
Yeah, I've seen people that, you turn on music and they may not be talking at all, but you put a song on and all of a sudden they're singing and they're dancing, and they're reliving moments, so, and definitely definitely a lot of fun in that aspect of it. And so
Exactly. And so I'm sorry about that, to interrupt you. So I also would like to tell you, when there's music and we do group occupational therapy sessions, and it can increase social skills for the older adults or the seniors, which is very important. Because it's done in a social setting, it can increase confidence and a strong sense of well-being. It also reduces anxiety and enhances the mood of the seniors, and it's a natural resistance or a natural relief for stress and back pain, and for individuals suffering from arthritis, gout, knee pain, back pain. It is very beneficial for them. So because aquatic therapy is a great way to stay active and lessen the pain on your joints, aquatic therapy is a great way to stay active and lessen the pain on your joints. So in fact, some seniors find it better or find it easier to perform certain exercise activities in water than they do on land. It also improves your cardiovascular health. And so, people think, how can I really get a physical benefit from this? But aquatic therapy is an intense form of exercise. It can raise your heart rate enough to burn fat and improve overall cardiovascular health. And also, most importantly, I always say this, it increases your strength and balance. So because it's done in water, at least waist deep, it will build strength for seniors to fight water movements and stay balanced. So moving quickly through the water can provide a natural resistance that builds muscle endurance, strength, and reducing the risk of their falls.
So let's say I want to do this. How do I get signed up?
Okay, so yes, ma'am. So the easiest way, I would say, is to use your favorite search engine or Google. There are multiple ways to sign up in your area. So for instance, or for example, if you were to Google recreation therapy services in Houston, Texas, I.D.E.A.L Therapies will come up. You would click on the link to that website, and once you're on the website, you will sign up for a consultation. After the consultation, a free consultation. After the consultation, you should, and should you feel that recreation therapy is right for you, a CTRS will complete an assessment to find out your pain points and interests. And after the assessment, a treatment plan will be created specifically for that individual, and the services will begin.
Do you know whether it's covered by Medicare or insurance, or is it private pay?
Both. So most recreation therapy companies or agencies do accept Medicaid. I.D.E.A.L Therapies definitely does. And then if you don't have Medicaid, private pay is also an option. And there's also private insurances as well if you don't have Medicaid.
Perfect. All right. One quick question. What made you decide to do this? Because this was an unknown for me. So you obviously knew something a little more than I did. So I'm kind of curious because there's usually a story.
Yes. So I kind of get emotional every time I think about it. When I first started college, my first major actually was athletic training. So in college, I had to get myself through college financially. So I worked full time and I went to school, but I worked more than I focused on my schoolwork. And so long story short, I fell behind. Talking to my counselor, we were talking about what I could do to still graduate on time. And she brought up this major, and I said, I never heard of it, but cool, let's try it. So I got into the class and then I did my internship at the VA hospital in Biloxi, Mississippi. And it changed my perception. It changed my life, actually. I worked with seniors and short-term memory care, long-term PTSD, the blind rehab. They had so many different populations, but all seniors. And it gave me a sense of purpose. And now to this day, I don't feel like when I'm working with a individual, I don't feel like I'm working. I'm just having fun and I know I'm making a difference. So it's a very rewarding job. Very. Both ways around.
They say, if you feel like you're not working, even better,
Exactly.
So Harriet, how does someone find I.D.E.A.L Therapies?
So definitely, you can definitely Google it. Also, our website, you'll go to IDEALtherapies.com. And on there, you can sign up for free emails to be part of our email subscription, and also just fill out a short form if you're interested in getting your free consultation. And then myself or one of my staff will reach out to you and answer any questions you may have.
Okay, and your telephone number?
Telephone number 832-952-7566.
And your email?
Email will be Harriet, Harriet Wilson, Wilson at IDEALtherapies.com.
Perfect. And so it's been a pleasure. It's been so much fun, and I'm so excited to learn something new because this was definitely something new for me. So I'm super excited to meet you. And,
yes,
and I'm sure we'll talk again soon, and you have a great day.
You as well. Thank you for having me. Have a good one.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.